Hello, everyone. Welcome to Coffee Break YXE. I almost said the name of the other show that I host here on our network. Welcome to Coffee Break YXE for Monday, May 31st. Glad that you're here and glad you could join us. I wish I could say that I was excited about this episode today, but it's a bit of a somber topic we're going to talk about today. Last week, there was news toward the end of the week that there was a discovery of about 215, mass graves or burials near a former residential school in British Columbia. And it's sad news. I wish I could say I was shocked about it, but those that have worked, like myself, have worked in Aboriginal media know that these graves are out there and they're right across Canada. But over the course of the weekend, I guess this news has picked up some momentum. So we thought we would dedicate this episode to discussing some of the issues and this story, and talk a bit about residential schools. So ironically, I had a guest booked, Dr. Paul Hackett, and we're going to talk about another subject. But given the news that we have today that broke last week, we thought we'd shift what we're going to talk about. So I'm going to bring in now our guest, Dr. Paul Hackett with the University of Saskatchewan. Dr. Hackett, thank you for joining us.
Hi, and thanks for having me here.
We were going to talk to you today. We'd kind of set up this interview. We're going to talk about, I guess, for lack of better, walkability and health of cities and urban cities, yeah. which would be a great thing, and it'd be wonderful to talk about. One of the things that's happening today is the cities changing their rolling out more of a point-to-point transit system. That kind of precipitated the talk about walkability and other things and how we get around cities. We're going to shelve that for today. We want to talk about residential schools and kind of shift and talk about some research that you're involved with. But before we do that, first of all, you're a professor at the University of Saskatchewan. Can you talk a bit about what kind of research you do in general?
Yeah, I'm associate professor in geography and planning at the U of S. I'm also a member of SPIRO, the Saskatchewan Population Health and Evaluation Research Unit, and we do pop health research. The research I do is typically historical. So I'm interested in the history of Indigenous health, and particularly with respect to First Nations health. And I've been doing this for a long time, since the 1980s, and it's become more topical as we discuss issues around the COVID pandemic and treatment and vaccines and all stuff I've worked on in the past, but as well tuberculosis and diabetes are two of my main kind of research thrusts at the moment. So I'm interested in kind of the past relationship with tuberculosis of Indigenous communities, and also the emergence of type 2 diabetes, which is epidemic in some communities, and certainly elevated in general in First Nations populations. I take a historical perspective, but it's linked to the present. These are trying to look at contemporary issues by looking at the past. And part of this is looking at residential schools and their impact on the immediate and long-term health of First Nations communities in Canada, particularly Western Canada. I tend to focus on the West because I live in the West and I know more about it there. Yeah, and historical methods, we've done interviews and things like that as well, but I tend to focus on the documentary record. And as you say, none of this is surprising, but it is, well, it's incredibly troubling, but it's what we've had to deal with in terms of understanding the terrible history of residential schools in Canada over the past 100+ years. And anyway, that's pretty much a synopsis of what I've been doing and hopefully continue to do.
Thanks for that. And let's try and drill down, because there's kind of two areas that I want to talk about, the research that I know that you've been involved with. And one of them is looking at historical records. Now, I'm going to try and set this up, and then you can correct me or continue. At one point within the last few years, you had access to documents which kind of indicated kind of health indicators of children arriving at residential school and looking at what happened afterwards. What did that data show you? And yeah, tell us about that research.
Yeah, sort of setting it up a little bit. we've seen a shift in Indigenous bodies, First Nations bodies, towards obesity over the 20th century, and um, what I was originally interested, or we were originally interested, I had partners on this, obviously, and we were seeing, was that sort of the overweight, obesity reflected in the records of the residential schools. So how far back does it go? And so in order to do that, we looked at, I think it was 7 schools and hundreds and hundreds and hundreds of, or thousands of records of kids entering residential school. So before they enter residential school, they had a physical examination, and we have records for many of those. And so we use them to calculate body mass index values. And there are problems with BMI values that we acknowledge. But as a general indicator of nutritional health, whether kids were where we would like them to be, it's at least a sort of an indicator, if you will, of how things were. And so we looked at from the 1930s to the 1950s largely, although there were some records that go back as far as 1919. And we found that kids were entering residential schools with what we would consider to be relatively healthy body weights, but BMIs. And so this indicated that nutritional health, and there are other indicators that we calculated, was pretty good coming out of the community. The kids were not starving coming out of the community from the 1930s to 1950s, although there's a slight uptick in weight over that period. They're not overweight. They're not drastically underweight. They're entering the schools in fairly good health. And that's where things go awry. So they're entering residential schools relatively healthy in terms of body weight and BMI. Once they get there, though, there's indications that malnutrition was creeping up. And Dr. Ian Mosby has done some phenomenal work on nutritional experiments in residential schools that were carried out with the Canadian government, with cooperation of the schools, obviously. And what Ian found was they were justifying these nutritional experiments, and during the same time period that we're looking at the kids coming into the schools, by saying that they were malnourished. So kids were being tested using as part of the nutritional experiments, justified by the fact that they were malnourished, but they weren't coming into the schools malnourished. And that's an important distinction. Is this isn't a problem that originated in the communities, it's a problem that originated in the schools. And so the conditions that emerged in the schools were those that were conducive to poor health, which can affect tuberculosis rates, but also has long-term effects on the individual, potentially leading to diabetes, type 2 diabetes down the road. And we've seen that growth in subsequent decades, as well as potentially intergenerational effects based on this. So it's all tied up in the current issues that we're facing, and particularly First Nations communities are facing in terms of health. The past, you can't get away from the past, as we're seeing now.
So, okay, just get a bit of a frame here. Of course, we're talking about this today because of the news out of Kamloops, and that there was estimates that 3,000 people or youth or children died in residential schools. That number could be as high as 6,000, but there's not a lot of records. So we have that big frame, but there were kind of two pieces that I heard in what you said in the research, some of it Ian Mosby's research and some of your own. Let's touch on Ian Mosby's first. And I'm going to put a blunt statement out here, and I know scientists and researchers don't like it, but we in the media want this. Are you saying that with the consent of the federal government, scientific experiments were conducted on children in residential schools?
Yes. Well, Dr. Mosby's work is saying that.
Yeah.
And it's not my work, so I want to be clear
Gotcha.
that it's not my work. But as academics, we build on the work of others, and
Right.
and so yes, the federal government, in concert with the schools and the churches, were conducting nutritional experiments on residential school students.
And it's been a while since I've looked at that, because that information came out a few years ago. But there's things around fluoride. And
there's fluoride, vitaminized biscuits, and other things as well. And there are tests that were done on BCG vaccine for tuberculosis that were done in Fort Capel, sanatorium on Indigenous bodies, Indigenous people as well, and under Dr. Ferguson, that were tests as well. So we don't know the extent of all the medical testing that was going on or had been done under the auspices of the federal government, or as well the National Research Council, which was involved in some of this.
And I don't want to dwell on it, and I realize it's research that's done by a colleague or somebody else, but there's not only the scientific research, but it's also the denial of things for control groups. Is that part of it too?
Exactly. So you divide people into a case and a control, and you administer whether it's biscuits or BCG vaccine to a group, and then deny it to the other, which is, I mean, from a scientific standpoint, it makes sense. From an ethical standpoint, it's horrendous, particularly carrying these out on kids who had no choice but to participate in this. And I can imagine that this was not clearly articulated to their parents, and certainly the children were in no position to consent to these trials. So ethically, from a modern standpoint, from a present day standpoint, obviously these wouldn't fly, but we would be highly troubled by them.
Okay, let's leave that. Let's talk a bit about this. So the other thing I heard is that, and again, I'm going to boil this down to a sentence or a sentence and a half, is the people that survived residential schools, physically survived residential school, and they're not talking about all the trauma and multi-generational trauma, which is legitimate and probably a very serious issue we still need to address in Canada, but they entered healthier than they left physically. Is that a true statement?
From a perspective, from the perspective is nutritional health,
right?
And I would extrapolate from that there are many other ways. And as you say, I don't work on trauma, and there are Indigenous researchers and Indigenous voices that we need to amplify for that, looking at the trauma. But from the tuberculosis standpoint, children caught tuberculosis while they're in the residential school. In fact, it was a place where you would, when you send your child, when families send their children there was a very good possibility they would not survive that. And at certain times, perhaps the odds were like 50% and greater that a child would die due to exposure in the residential school system. So tuberculosis is inherently tied to the residential school, as are nutritional issues. And both of these can persist, and we still see far higher rates of tuberculosis among First Nations communities as well as Inuit communities than among the non-Indigenous Canadian-born population. So we're dealing with the fallout of these things as we go forward. And similar conditions are still at play.
Before we go on, I just want to remind our viewers that we want to make this as interactive as possible. So if you're watching, you have a question for Dr. Hackett, please feel free to enter your question or comment in the social media platform you're watching on, whether it's Facebook or YouTube, and we'll try and use your question on there and get Dr. Hackett to ask it. I happen to know that party research may or may not have been around the subjects we're talking about here, but part of it involves looking at historical documents. And as you go through the records left by the Anglican Roman Catholic Church or the government, are there any quotes or anything that kind of sticks out that you want to share with the audience?
Yeah, there's quotes, and to paraphrase, the government was complaining because First Nations parents were not willing to send their kids to residential schools because they knew that they were places where people die. So this is a place where, from the outset, so from the late 1800s in Western Canada, Indigenous communities and Indigenous families knew that sending their children to residential schools could be a death sentence. So it's not something that they later discovered. It's that these are things that people knew from the outset. But we also know that the government knew this from the outset as well. And in fact, the famous report is Dr. Peter Bryce's from Indian Affairs, the medical officer for Indian Affairs, in I think it was 1907, sort of blew the whistle on this. and then later published after the government had done nothing. I think it was around 1920, a national crime, which basically laid out for all to see just how terrible the mortality due to tuberculosis was in residential schools. And at that point, I think it was the Toronto Globe, um, published an editorial saying that basically we're at a crossroads and we can either shelve this report, that would be for the earlier report, or we can act on it. And what they chose to do was to shelve that report. So, it was known to the public, it was known to the media, it was certainly known to the families, and yet there was no action on it for decades. And it's not until we get to the 1930s and particularly the 1940s, I should say, that and post Second World Wars especially, that we start to see the action that should have been taken in the 1890s to counteract the tuberculosis that was rampant in the residential schools.
So, I mean, I think I know the answer, but what changed? Why later on was there kind of, I don't know if desires or why was it kind of dealt with eventually? Do you have any sort of speculation on why?
There's a few things, but I think it would boil down to two main ones. One was that in these days of COVID and pandemic infection, it's especially sort of poignant, was that by the 1930s and 40s, Indigenous communities, and again, particularly First Nations communities, were seen as hotbeds of disease. And the issue of tuberculosis had been dealt with fairly well in non-Indigenous communities. So in the cities and in rural communities through action by the provinces. But because the First Nations reserves were wards of the federal state, as they used to say, but they were under the control of the federal government, that the provinces could not step in. So on the one hand, we've got what we may call disease pools, and that's an awful way of putting it, but essentially from the federal government standpoint, that was the case. And from the provincial standpoint, that was the case as well, because they were worried about the spread of tuberculosis from First Nations communities to non-First Nations communities. So they saw it as they saw the need to stamp it out so that it wouldn't hurt white people. And the federal government they were constantly bothering the federal government and imploring them to act, because they could not act, they could not spend the money. And the federal government finally decided they were going to. And how they acted, and it's mostly post-Second World War, was they created a series of sanatoria or sanatoriums, tuberculosis hospitals, if you will, across Canada that were essentially for First Nations and Inuit people. And there was a massive system, and I believe you've lived where there was one up in Moose Factory. And basically, people were pulled from communities and put in these things so that they would be not at risk of transmitting the disease, but hopefully have treatment. And by the end of the Second World War, we're starting to get into the antibiotic era. And so we actually have the capacity to cure the disease, if you will, in an effective way. So it's a change in era, and the fact that they could do something, but also that they were willing to put the money in, and because they were perceived to be a threat. Whereas if you go back into the 1800s, where the rates are extremely high among sort of the lower socioeconomic classes in cities, there isn't as much of a threat because everybody's got tuberculosis, or many people have tuberculosis.
Interesting. And I know that tuberculosis research and the research in the sands is something that we're talking around, but maybe we'll kind of hone in a bit of what you have to say there and see if there's any connections to the news out of BC. But you're right. Yes, I did live in Moose Factory for 2 or 3 years.
Yes.
And at one point, I was house sitting the rectory, the Anglican rectory, over the summer. And I recall people would knock on the door, and they'd be from what is now Nunavut, and they were looking for information in the church registry about people that had died at the sand.
Yeah, massive displacement of people. And I think that's a really good point that we don't talk about. The sands are intertwined with reserves and communities and with the residential schools, because kids were being sent sometimes to the sands, sometimes they weren't. They would die within the within the schools. And I've written about that in the 1930s in northern Manitoba, where kids were dying in residential schools during a period where it just didn't occur among white kids, as we would have described it back in the day. Um, so, you know, the link uh, between the reserves and tuberculosis, and exploring that more in terms of its relationship with the schools and the sands, and even to an extent that hasn't been studied as much, the link to incarceration and prisons and tuberculosis in that context, and particularly for people who had been traumatized by the residential school attendants and therefore ended up incarcerated because of misfortune and mishaps and poor choices, let's say. There's a risk of tuberculosis there as well. So it's all part and parcel, it's all connected. So you can't really sort of segment out one aspect of it and say this is the cause or this is how it worked.
Yeah, you're right. The displacement stories is just huge. Let's try and bring it back to Saskatchewan, unfortunately,
Okay.
because we have former SANs in this province, former residential schools. And you kind of mentioned early on that people died at these SANs. Do we know all the records? Do we know how many people died at the SANs and where they're buried?
It's hit and miss, and uh, Dr. Avigny, who you know, and I have been working on Dynamore Indian Hospital in southern Manitoba, and we actually have the hospital registry, so we can see what happened, the outcomes from an earlier period to people who entered the hospital. But yeah, there we don't know the extent of it. If you look at the schools records, um, they there are sort of death inquests for some kids, and a child fell off a wagon and was crushed, and there's a full inquest around that, and the records are there. Other cases, we've got uh, fires that killed people in schools. We've got other records, but we don't. It's the tip of the iceberg, the proverbial iceberg. We don't have the full extent of records, at least not that I've seen yet, about who died. And there are ways in which we might be able to sort of work around this, but some of those records don't exist anymore for whatever reason, which is unfortunate because, again, we're coming back to what was going on in what has gone on in British Columbia. It's the not knowing, and people sending their kids to schools and having no idea where they ended up and what happened to them. Some cases, kids were sent to sanatoria, and so we know we can sort of follow them through that. Other cases, they were sent home, and in other cases, they died of tuberculosis in the school, and we just don't know the extent of this. It's huge, and it's a lot bigger than we can document, which is an unfortunate thing. But I think by listening to the community, we can get an idea of the scope. So if we talk not to the records, but to the community who lived that experience and have that knowledge that was been handed down between generations, I think that's our, as a society, we should be listening to those voices and understanding both the extent of the trauma that comes out of that, but also listening for clues about rewriting the history of these schools and the impact of them.
And that's a good way to tie it back to today, I think, is that um, we do have this news that broke last week of 215, I guess, remains found out of BC. Anybody who's kind of worked around in Aboriginal media or worked on doing research, you kind of hear stories here and there that there's more out there, and
Yeah.
you're right. We have to listen to the people and find out where perhaps we need to start looking. Do you think? First of all, I'll give you a chance if you want to chat about how you feel about what happened, the news from last week, but also, should we start looking in Saskatchewan? The Federation of Sovereign Indigenous Nations Chief Bobby Cameron's calling for that we got to start looking here in Saskatchewan. He has some ideas where to look. Do you think there's going to be political will? So first of all, let me start over. How do you feel about the news that came out last week? And do we need to start looking at TB SANs and residential schools here in Saskatchewan for remains?
Yes. I'm not surprised. Like any researcher that works in this area is not surprised in a way that you might if the evidence of a horrible massacre such as the Katyn massacre during the Second World War, you would expect it, unfortunately, and it's incredibly tragic. And your heart goes out to the communities, because these are their people. And so it's not just merely the remains of individuals, but it is their community. That's a big part of their communities there, and tragic. But there are also the stories that we haven't listened to in the past. So these are their stories that they've been talking about for decades, many decades, and we haven't been willing to listen. We, as a society, I don't mean me or historians and historical geographers in general, but I mean, as a society, we have not listened, and we need to listen. Going to your second part of that, whether we need to investigate this in Saskatchewan, yes, we do, and we need to expand on that. I think that we need to expand on that in terms of the sanatoria and looking at the same sorts of issues and what was going on. We need to think about this in terms of incarcerated people and what was going on in terms of tuberculosis and other issues. You can't separate them, because it's the sort of through the life course, and is part and parcel with the trauma of the residential schools. So I strongly support FSIN. I strongly support that call, and would be honored to, if I can contribute to that in some way. And I think that's part of our role and responsibility as academic researchers, is that we need to help the communities, and we need to realize that we have a debt to those communities, and to collaborate with them, but also to listen to them.
Dr. Hackett, I think we've pulled on a lot of strings, and we've had some answers, but I think we've really left ourselves with more questions. I'd love to have you back on as this story develops, but also have you back on for what we originally booked you for, to talk about the walkability of cities. I really appreciate your time that you gave us today. Any final comments before we let you go?
No, well, yes, and look at the TRC and the calls to action. As a country, we need to do that, and this is laid out in
TRC, Truth and Reconciliation Commission.
Pardon
report,
me.
Right?
Yes. That's a roadmap that we need to follow. But listen to the communities, listen to the organizations, listen to the voices of the people, and especially for people like me, step back, listen, and don't talk. And that's a conversation that we need to have. So I think that's my perspective on this, is that we need to amplify Indigenous voices in this case, and to support them in what they call for.
Thank you for your final words, and thank you for this time that you've given us today. We really appreciate having you on, and I'm sure if you're up for it, that we'll have you on. And again, like I mentioned, that's kind of it. Thank you so much, and
thank you, Ian.
And we'll have you on again. You take care.
You too. Bye now.
Dr. Paul Hackett joining us from his home here in Saskatoon. That's kind of a heavy subject that we've dealt with, but now we want to try and, I don't know if I can segue smoothly into this, but we want to bring in Matt Morrison, who's the host of a show that's on this evening. Matt Morrison joins us now, and I want to talk to Matt about what's on his show tonight at 6 p.m. on YXE Sports Podcast. Matt, how are you?
Good, Ian. How are you doing?
I'm okay. That was a bit of a heavy subject that we just dealt with Dr. Hackett, so I wasn't sure how to talk about a hockey game that's on tonight after that, but here we are. So let's shake that off, and what's on for your show tonight, Matt?
Yeah, well, we're going to talk about the NHL playoffs. The Toronto Maple Leafs and the Montreal Canadiens are heading to a Game 7 tonight. Now, Ian, you know this, that we're both Leafs fans, and they have completely just messed this up royally. They were up 3-1 in the series. Now it's heading to Game 7, and it's not looking good for the Toronto Maple Leafs tonight. So hopefully they can pull it out against the Montreal Canadiens. But we're going to talk about that game. We're going to talk about some other stuff that's going on in the NHL playoffs. And it was also recently announced over the weekend that the Moosomin First Nation is donating a horse racing track that's going to be in the RM of Corman Park. It'll be called Moosomin Downs. So that is going to be a big thing for the horse racing community. Of course, everything that went on with Marquess Downs not too long ago. So I know the horse racing community was, rightfully upset and disappointed in that news. So hopefully this gives them something positive to look forward to as well. So that's kind of what's on tap for the YXE Sports Podcast tonight.
Sounds exciting. All starts at 6 o'clock live from Windows.
Yes, sir.
Before I let you go, how long has it been since, and put you on the spot, how long has it been since the Leafs have advanced to round 2?
2003, 2004.
Excellent answer.
Yeah,
You're
right?
good.
Yeah.
What the heck? Down.
I know.
They're up 3-1.
Yeah. Yeah, they really don't want to win. So I don't know what else to tell you. Also,
we'll start watching the game at 5. Stop watching at 6 to watch the show. Then back to the game at 6:30.
One more quick note on that, Ian. It was announced over the weekend or today that the Ontario government is allowing 550 fully vaccinated healthcare workers, nurses, and long-term care workers to attend the game in Toronto tonight. So a good job there by the Ontario government to allow the people on the front lines that have been working so hard over the past 13, 14 months to get out and hopefully take their mind off of things for a couple hours.
At least Toronto is home ice tonight?
Yes.
And did they had some fans last night, I heard? Was that in Montreal?
On Saturday, yeah, 20. So there's 2,500 fans in Montreal to take in the Saturday night game, and there'll be 550 fully vaccinated healthcare workers tonight in Toronto.
Wonderful. YXE Sports Podcast tonight, right where you're watching the show, 6 p.m.
See you then.
Thanks, Matt. Bye for now. Sorry for cutting you off. I just hit the button there too soon, Matt. Thank you so much, everybody, for watching Coffee Break YXE. Tough subject tomorrow. I want to mention that we have a show at 10 o'clock. Our guest tomorrow, we're going to start with Dr. Nazim Mahajareen. He's a professor of the community health and epidemiology here at the University of Saskatchewan. We're going to talk to him about, the pandemic, how things are going in our city here in Saskatoon, and specifically, I guess, the plan for reopening Saskatchewan, how he feels we're doing and what we should be doing maybe a little differently or if we're on track. Then our second guest tomorrow is going to be Darcy Young with the Nutrients Children's Festival of Saskatchewan. They're going all virtual this weekend. We're going to talk about their plans for the festival coming up this weekend in a virtual sense. That's it for us here at Coffee Break YXE. Don't forget YXE Sports Podcast on at 6 o'clock tonight, and we'll see you back here tomorrow at 10 o'clock.